Right. Hello, everyone. Thank you for joining us tonight. I'm here with Kim Hall from Physio to You. They're a partner with the In-Training program this season and providing us with some awesome articles and information related to running. And yeah, over to you, Kim. I'll let you take it away.
Thank you for having me. So I am a physiotherapist and an avid runner, and I'm here tonight to tell you about some common running injuries and how to best avoid them or treat them if you are experiencing them. And then I'm also happy to answer questions you might have about any aches or pains that you're experiencing and how to best support you in your training goals, whether it be 5K, 10K, half marathon, marathon, or beyond. So the three most common running injuries that I see for long distance runners, people kind of gearing up with more mileage, is plantar fasciitis. So that's pain, tightness in the foot. Hip tendinopathy is what we call it now, hip flexor tendinopathy, and shin splints, also known as compartmental syndrome. So plantar fasciitis, I'm actually going to just show you guys my foot. So the human foot is an incredible structure. Does anyone have any guesses as to how many bones are in one human foot? You can tell me your answers or you can put them in the chat. Jenny will let me know your best guesses.
Lots.
Yes, you're right, lots.
23, I don't know.
Good guess, you're close. Yes, there's 28 bones in our foot. So the amount of movement that a human foot is capable of is pretty similar to our hands. And you'll see people who lose function or aren't born with hands, they have incredible dexterity in their feet. And it's because if you use it in practice, then our feet are actually very, very mobile, can be very strong, have a lot of stability that can be conditioned and trained within a human foot. With footwear, most traditional footwear, I work a lot with seniors, so a long time ago, men were wearing thick leather shoes that basically made their foot like a club. There was very little bending of the toes, and the average woman was wearing a low heel with pointed toes, so her foot was jammed into a leather shoe. So I see a lot of osteoarthritis in seniors who grew up in Canada. Interestingly, I worked at Richmond Hospital for quite some time, and we have a large Indo-Canadian population in Richmond, and the Indo-Canadian seniors had no arthritis, no deformities of their feet. Why?
Shoes.
They don't wear shoes, so they would have grown up wearing bare feet. They walked barefoot to the market, they walked barefoot to school, they walked barefoot everywhere, and their feet are incredibly strong. And now what do they wear? Usually sandals or flip-flops. Like they're still they still rely on the integrity and muscles and strength and stability of their own foot in order to be supported, not on a shoe. Exactly. So you'll see the trend in shoes over the last 20 years has been more mobile. You have things like the Nike Free that have like so much movement between every plane going this way, and that's to allow for these 28 bones in our human foot to be incredibly mobile. So if you do not own one of these balls, or like if you don't have a golf ball, this is going to be one of your best friends as a runner. It's incredibly important to massage and loosen up all the structures in the bottom of our feet, including the plantar fascia. If you don't have a ball like this, you can use a golf ball even. It's the right size, and you want to be able to massage the bottom of your foot going lengthwise, so kind of toe to heel. And then you also want to go across the balls of the foot. And when you might find an area of tightness or a place that hurts so good, that's kind of where you would want to spend time. So I tend to use this before I run and after I run. It's incredibly important for both. So you would roll heel to toe out 10 times, cross the balls of the feet 10 times. And then also you can like practice putting your toes kind of over it and up, over it and up. And that'll give you some basics to be able to improve the strength, flexibility, and stability naturally in your foot. And it's a good way to treat plantar fasciitis. And it's also a good way to avoid plantar fasciitis. If you don't already have any foot tightness or foot pain, then make sure that you've got a ball to be able to do that sort of self-release and self-massage. So that's plantar fasciitis. Does anyone have questions about plantar fasciitis?
I understand that in the morning, I haven't had it, but I understand in the morning it's very tight. Is there something that when you get out of bed, that's how one knows they have it? Is there something special that they can do in the morning to relieve that, or just, again, massage it?
Yes, massage it. And then lots of people, including myself, like to wear slippers first thing in the morning, or yoga sandals, you know, the sandals that like spread all 5 of your toes. A lot of people, especially if you've got hardwood floors or laminate floors, it is sometimes wise to have a bit of cushion on your heel first thing in the morning when your body's kind of warming up. And then, yes, within an hour of waking up, if you can do these sort of exercises, that can be very helpful.
Okay, good, thanks.
Great, you're welcome. Okay, the next thing we're going to talk about is hip tendinopathy. So many years ago, you would have heard the term tendinitis. Tendinitis. The research now shows that itis, or inflammation, is not actually possible in tendons. Tendons don't have a lot of blood supply, and they don't really get inflamed the way a muscle or a joint or other structures that are more vascularized can become inflamed. So they like not to use the word tendinitis anymore. They use the word tendinopathy. So it just means there's a problem or there's an issue. There's something idiopathic going on with the tendon. I have pretty good Latin because of my medical terminology. So idiopathic, something's going on with the tendon. And because running is so repetitive in this plane, right? Running, we're using our hip going up and down, up and down, up and down. We don't really go out to the side the way tennis would, or basketball, or dancing. Running is very repetitive. And because of this repetitive movement, hip flexor, so our hip joint flexion means bending forward, our hip flexors can become very exhausted and fatigued, and getting some tendinopathy or pain in the hip flexor area is a very common overuse injury for runners, new runners as well as experienced runners. So to avoid, or what you can do to, yes, avoid as well as treat hip flexor tendinopathy, is to stretch and strengthen both the hip flexors as well as the muscles on the side of our hip and on the back of the hip. So basically all the muscles that stabilize our hip joint. So the best exercise for stretching the front of the hip is you can put your knee up on a couch or stool. If you have good kneecaps that allow you to kneel on the floor, you could go on to all fours on the floor. But basically, you're going to want to try and pull your heel up towards your bum. So I practice this every day, so I can get my heel to my bum. But you're going to feel an incredible stretch there. If you can't get there, that's okay. You can go here. If you can't even reach your foot yet, that's okay. You can, prop it up on pillows, or you can keep it where it is and then lean back, and you're going to feel a big stretch in the front of the hip. For stretches, it's important to hold at least 10 seconds, but going up to 20 seconds, 30 seconds is even better. When you do stretches, any stretches, you don't want to feel any sharp pain. You should just feel tension or a pulling sensation, but no sharp pain. If you feel sharp pain, then either back off, or you might have to alter the way your line of pull. So sometimes with this quad stretch, it might feel better to pull with the opposite arm, because then you're not torquing your leg out to the side. So you can play around with which side is more comfortable. If you don't feel too much a stretch, another way to make this a more extreme stretch is to lift the arm up. You might have heard about fascial trains, or we now know everything's connected. Remember the hip bone's connected to the thigh bone, and all the muscles, the fascia, connective tissue, everything's connected. So if you lift the arm up, you're going to get an even more extreme stretch down all the muscles and tissues in the front chain of our body. So that is how you stretch your hip flexors and avoid hip flexor tendinopathy, or treating hip flexor tendinopathy. Stretching is best to do after we run. Before we run, we want to warm up. I know there's lots of good training videos on running warm-ups. So I encourage you to check out the SportMedBC YouTube channel for those videos. But stretching for the hip flexor is important to do after you train or after you run. Any questions on hip flexor tendinopathy? Okay, and the last common running injury I will discuss is shin splints, also known as compartmental syndrome. So if we were to take a cross section of our lower calf, or of our calf, and you looked at it like a cross section, you would see a whole bunch of circles and compartments and dividers. There's a lot of different structures in our calf. We have 2 bones, quite a few muscles, a big vein, nerves, and in between all of those compartments is fascia, kind of separating and containing things. And compartmental syndrome, or shin splints, is usually when one of the compartments becomes irritated and inflamed. So people with shin splints might feel it right on the side, they might feel it in front, they might feel it down their shin bone, down the tibia. Often shin splints doesn't really travel, like you'll have one site that is really painful, especially with like repetitive weight bearing. So with shin splints, it's really important to consider your footwear and the running terrain that you're on, as well as your running form. So making sure that you have good footwear. General rule of thumb is that your shoes need to be replaced every 6 months, possibly 12, depending how much you're using them. Another tip I have is you should have at least 2 pairs of running shoes that you're kind of revolving through. So the main shock absorber in our running shoes is foam, and foam needs a certain amount of recovery time in between in order to have the best shock absorption property. So if you're wearing the same pair of shoes every time you train, you're actually going to wear them out a lot faster. You won't be able to get as many runs out of them if you are wearing them maybe 2-3 times a week. So I always have 2 different pairs of shoes, running shoes on the go. And for me, I usually have like my kind of longer distance, like thicker cushioning, and then my thinner cushioning that I might use for track workouts or shorter runs. And I interchange, and then that way both of those pairs of shoes will typically last me 12 months, if not longer. So that's a good tip, is to buy 2 pairs of shoes at a time, and make sure you're switching back and forth and allowing that foam to recover in between use. You need to consider your terrain. So if you're new to running, or you haven't ran for several months and you're getting back into it, jumping right on the roads isn't advisable. A little bit of road is okay, but if you can mix it up with some trail, some gravel. So in Richmond, we have the dike, which is really fantastic because it goes for miles and miles and miles, and it's all gravel and nice. There's lots of parks around with bark mulch. I can think of like Mundy Park in Coquitlam, or Burnaby Lake. Actually, that's more gravel now, but bark mulch, gravel, you want to try and mix your runs and slowly get back to doing more and more on the road. Of course, most of our races, whether virtual or someday when we have our in-person races again, they will often be on the road. And so, of course, you need to include road running as well. But if you are having issues with shin splints, then you should avoid the roads for the time being and try and train on grass or artificial turf. Also, the trails. Running form. So if you watch high level runners, even the marathoners, the human body is designed to land kind of more on flat footed and then push off of the toes. So the really fast runners are not decelerating themselves and striking their heel every step. That is not great form. For anyone who's new to running, if that's how you run, then I'm just happy you're running. Don't worry too much about the way your foot is striking. But if you have more experience or you're having issues with shin splints, you have to kind of pay attention to how you're running. If you go for a sprint, the next time you're training, try sprinting and notice how your foot lands. It will land on the toes. You will not be striking your heel with every single strike. So if you are experiencing shin splints, you do need to consider your running form and maybe have your coach or somebody who has a lot of running experience be able to give you some tips, and you should be avoiding heel striking. Because every time you heel strike, it's actually putting a lot of force up to the shins, and often is going to be an irritant to the compartments and cause compartmental syndrome or shin splints. So trying to land more on the midfoot or thinking like of a light step and rolling onto the toes will decrease the likelihood of shin splints. So any questions on shin splints or compartmental syndromes or good running form from the foot?
Yes, I have one. I'm a serious walker, not a runner. Any tips on how I should be placing my feet?
Walking, it is normal to heel strike. Okay. So heel striking when you're walking is normal, and as long as you're taking a long, even stride and swinging the arms even with walking, then that's how you walk. Yes.
Thank you.
You're welcome.
Sorry, with shin splints, do mobility and in the kind of ankle joints and calves, do that come into play a lot too? Or would you say it's more of a mechanical?
I think it's more mechanical. So changing your footwear, altering your pattern is most likely, changing your terrain is most likely going to combat it pretty quickly. But yes, ultimately a physiotherapist can also assess the ankle mobility and range of motion, flexibility, calf strength. These things will also come into play with decreasing the likelihood of shin splints. Yes. I will show you. So in addition to the football, the other thing that is key for runners to have is either the stick. Have you guys ever heard of the stick? So they're a little bit flexible. You can get them in different flex. So mine's kind of like a medium to firmer flex, but you can get softer flexes. And this can be very good for treating shin splints because you're able to roll and it can form because there's a little bit of flex to it. It'll form around your muscles. So I always use my stick on my calves. You can use a foam roller as well, but I actually prefer to use the stick because it's less work. On the foam roller, you're using your upper body to kind of like propel back and forth. And so whether you're feeling the pain more on the side or the back or the front, you can adjust and roll that out. So the stick is one of your best friends. You can use a rolling pin if you don't want to purchase something like this, but I have used rolling pins with people if you're not doing much baking these days and you don't mind putting it on your leg, then you can use a rolling pin as well. And I would do that for 2 to 3 minutes typically after. You can do it before as well to kind of as a bit of warm up and get the circulation going, but it's even more important for your recovery afterwards, after you train, after you run.
Kim, does it make a difference if people have flat feet? I've had a couple of people tell me they have flat feet and they get shin splints. Is that related, or is it just bad form?
Yes, it is related. And somebody with flat feet, some people are born with a foot structured that is more flat, but for the average adult who has a flat foot, it's because they're not exercising their feet. They're not doing all sorts of strengthening and range of motion and flexibility exercises for the foot.
Oh, okay.
Would you guys like to learn a few foot exercises?
Yeah.
Okay. So I am on my iPad so that I can show you guys. So take off your shoes and socks if you have any on. And I'm just going to demonstrate here. So you know how with our hands, we can lift up our thumb separate from our toes. The muscle that lifts our thumb up towards the ceiling is different than the muscles that lift the other 4 fingers. The same is in our foot. So everyone should be able to keep the ball of the foot down and lift up all your toes. Everyone should be able to do that, but try just lifting the big toe. And you can try that 10 times. It might be difficult. You practice your coordination, and then keep the big toe down and lift the other 4 toes.
It's impossible.
So this is a really good one to practice. I have like taught 80-year-olds how to do this. So anything is possible if you practice. And this is a really good one for improving the arch. You know, if somebody's got a flat foot, strengthening these muscles on the top of the foot are one of the ways to help restore that arch. So I would recommend trying to lift the big toe 10 times, and then you keep the big toe down. If you need to help it originally, you know, if you need to keep pushing the big toe down in order to lift the other toes, then do so. The other really good toe exercise is, so you know how our hands, this is called abduction. So we can put our toes together, we can abduct. So all day we use our hands. Do we use our foot the same way? No, usually our foot is in a shoe and our toes stay like this all day, but they're actually designed to splay and to open. So that is what I want you to try. So you can have the toes together and then you splay them open. So you can probably see on mine. So I do practice this every day. It's part of my recovery. I do this like after a long run. After my Sunday long runs, the first thing I do is take my shoes and socks off and put flip-flops on, because after our toes have been jammed up like this for an hour or longer, 2 hours, however long your long run is, like they really need to stretch out. So this is my favorite exercise to do. The first thing I do after a long run is take the shoes and socks off, flip-flops on, and spread the toes. So that is your homework, everyone.
It's so much concentration.
Yeah,
Yes.
it sure does.
You're using a part of your brain that hasn't been used in a long time. But for some of you who might have studied anatomy, like we have the motor homunculus. And so we have brain cells that are dedicated to our foot. And so if those haven't been used and fired in a long time, then it is going to take a lot of concentration. But if you practice, then that part of your brain will become fired up and it'll be easy, and you could do it while you're in your next Zoom meeting or something like that. Yes. So does anyone have any aches or pains that they want to tell me about? And I can ask perhaps a few questions to get a bit of clarification with what might be going on. I do want to preface that always seeing a therapist, whether it's a massage therapist or physiotherapist, athletic therapist, chiropractor, and getting a proper physical exam and assessment is always going to be the best, but there are a lot of common things that runners experience that I might be able to give you some tips and recommendations on.
I have a pain on the beside my kneecap on the inside, and it's just like maybe an inch long area, but it feels like I kind of tweaked it.
Okay, and is it your left knee or your right knee?
It's my left.
Okay, and so you just feel it on the one side?
Yeah, I have had it like a year ago on the other side, and I got new runners and it went away. So
Okay.
It's not, it hasn't, it's okay. I can still run. And it doesn't hurt so much when I run as after.
Okay, so there's a few things that could be going on. The kneecap actually floats in a joint space above our shin bone and thigh bone. So if you were to see a therapist, that would probably be the first thing I would assess, is to see the quality of movement of the kneecap. So sometimes people have a little bit of arthritic changes and it makes the kneecap really stiff and it doesn't glide the way it's supposed to, and it could impede your normal function. And so that would be the first thing you could try and play around with, is keeping your leg relaxed and putting your, if you keep your leg relaxed and in a not all the way bent and not all the way straight position, but if you keep it a little bit relaxed, you should actually be able to push the kneecap side to side. It should move about a centimeter or two to each side. So that's one thing you could check. You can compare it to the other side. If it's really stiff, then that could be one thing that's going on, is the patellar femoral joint or your kneecap is not gliding properly and causing the pain. You could also have strained a ligament. So that might be ice and bit of rest in order to let the ligament heal. And then you would also want to make sure that you're stretching. So in the kneecap, there's a few, in the inner knee, there's quite a few muscles that insert there. And so making sure that you're doing that, the hip flexor stretch or stretching your quad will be important, as well as the muscles on the inside of the thigh. So we call them your adductors. So like doing the standing groin stretch or the sitting butterfly stretch for your adductors would also be important for releasing any tight structures around your knee.
Great.
And again, remember 10-second hold minimum, up to 30. And then you can also ice. So pain, if you're feeling it after you're running, you can ice it in order to help manage the pain and inflammation you have there.
Great. Thank you very much.
You're welcome. Any other niggling aches or pains?
Yes, long hard walks afterwards, I've been getting glute pains. I've broken both my hips in the last 6 years. Don't know if that's a factor.
So glute pain when walking.
After, usually.
Usually after, okay. So how long are you walking for?
60, 70 minutes. Just did 70 minutes today.
Okay, and is it flat or hilly or?
It varies. Sometimes I do hills, sometimes I do flat.
Okay.
Probably I get it more on hills.
Okay, and are you feeling it while you're walking, or like
No.
kind of after you finish walking and you stop?
It's after the next day and stuff like that.
Okay, and then are you doing much stretching after your long walks?
I'm doing some, yes.
Okay, so are you spending a lot of time sitting as well? I'm not sure.
Yes.
If in this COVID era,
Yes.
you're sitting a lot. Okay, so do you know what the largest muscle is on our human body?
Skin?
Pardon me?
The skin, but that's not the one you're talking
That's
about.
the skin organ. What's the largest muscle on our human body? Any guesses?
Glute max.
Gluteus maximus. That's right. So it's our butt. And so when our butt contracts, like particularly doing hills, it's getting worked out. And if you're walking repetitively, there could be some tiredness happening from repetitive walking in your glutes. When we sit all day, the glute is being stretched. And so the average person right now who is spending a lot of time sitting has weak glutes that are too stretched out. And so making sure that you're doing hip or glute exercises, as well as exercising our back into like a more backwards movement, is really, really important, because every day we're spending too much time forward, whether we're on the computer, driving, knitting, washing dishes, cooking, everything's forward. And our back is able to, you know, bend backwards. And so it's really important to exercise our spine in that way, especially when everything's so far forwards. So after you do your runs or your walks, after you do your long walks, I would suggest making sure you spend some time with your back in extension. Do you own a stability ball?
No.
Okay. Would you be willing to get one?
Maybe.
So the ball is kind of a safe way to practice. This one's called a ballast ball, so there's sand in the bottom to keep it. But the ball is kind of like a safe and easy way to hang out like this. And if you can spend a minute, great. But in the beginning, maybe you can only spend 10 seconds, and then you have to come up, and then you can go down again. So stretching out like this after your walks is going to be important to kind of normalize what's happened in your back from the long walks, as well as sitting for most of the day.
Thank you. I'll get one.
Yes. And the other thing, before you walk, you should do some hip activation exercises. So just a simple bridge. So a bridging exercise is lying down on the bed, on the floor, feet, knees hip width apart, and then just lifting up, holding about 3 seconds and down. So this is going to activate your glutes and get the blood flowing, making sure that they're working properly when you do your long walks. And I would do 2 sets of 10 as a warm-up.
Thank you.
You're welcome. And again, like, you know, if it persists, I encourage you to see a specialist, because there's lots of other things that could be going on as well. But in general, if you're not feeling it till the next day, it's probably something more with like things stiffening up and not being, in best alignment. Or improving your spinal flexibility helps many things.
We got another person, Corinne, joining us. And Corinne, you got in at the Ask the Physio section here. So we're going through, if you have any questions about aches or pains or anything you want to ask him about and get advice on, this is your time.
Sure. Sorry to join late. I'm curious about feet. I've been having a problem with one foot just across, actually on the top of my foot after runs, sort of along the top of my foot over the third toe, being very sore, and being sore on the flex. So not when I'm still, but when I'm walking or running. Okay, and then so is it like right on the joint or more on the top of the foot where you would feel the pain? Yeah, sort of on the top and this way. Okay, so you'll have to watch the recording of this, because we talked a lot about the foot and we did some foot exercises. But if the top of the foot is sore, one thing to consider is your footwear and the tongue. Sometimes it might be too tight. If it's brand new, sometimes the tongue is like extra puffy, and after a few uses, the foam will compress a bit, so it's not causing so much extra pressure on the top of the foot. You can also try letting the shoelaces out of the top eyelet. So that's one thing. If the soreness is coming from too much pressure from the shoes, that's one thing you can do to try and offset that. In
the exercise video, I gave some exercises for strengthening the muscles on the top of the foot that lift the toes up. So if you practice those, as well as massage your foot with a ball, so golf ball or one of these like foam rubber balls that you can get at most sports stores now, and then making sure you're massaging the bottom of the foot from heel to toe as well as across. And then you can also like grab the toes with the ball and splay the toes. All of those things will help improve the mobility in your foot, because our foot actually takes a lot of repetitive movement when we're running. And so, yeah, having foot issues is common. There are nerves as well that run in between, kind of like in between the foot bones there. And if there's any sort of inflammation or irritation to the nerve, that can also cause pain. Are you getting much like shooting or pins and needles?
No, nothing like that.
Okay,
it's more just as I'm walking or running, and it's getting better now, but in the motion of that rocking motion, just sore.
Okay. I'll give you everyone one other good strengthening exercise, which helps with the foot strength as well as running. So it's for tibialis posterior. So if you take a tennis ball or other ball and squeeze it between your ankles, and then you can hold something for a bit of balance, and then you're just going to go up on the toes and down. So because you're getting the pain there, when we run, we are pushing off on our toes all the time. And it's really important to make sure you have good flexibility there. You could even look up I can send the YouTube video, it's ballet foot exercises. So being able to move our toes this way is one thing, but we actually all should be able to do this as well. So again, this is not a common movement people do, but in order to stretch out the top of the foot, you might want to try bending the toes underneath, putting a little bit of pressure on it, and you're going to feel a big stretch down the front of the foot. And you can hold that for 10 seconds. See if that helps. But yeah, strengthening up and strengthening our muscles like this, because every time we run, we're pushing off from our toes. Strengthening our calves is important. And if you squeeze the ball between your ankles, we're actually getting a slightly different portion of our calf that is often neglected. It's called tibialis posterior. Yeah, if you squeeze the ball and lift up, hold 3 seconds down, that's going to strengthen the tibialis posterior, which will help give your foot more integrity. We talked earlier about fallen arches. Strengthening tibialis posterior is really good for flat feet or fallen arches.
Thank you.
You're welcome.
Kim, if you, I've had some people complain about hip problems, and I'm sure that with the Zoom culture and the pandemic, that there's a lot of sitting involved. Now, when you run, are you using different muscles and so it's sort of antagonistic, or when you run, are you using the same muscles and it's overusing them?
When we run, we're shortening our hip flexors and they're getting used over and over again. And when we sit all day, we're shortening our hip flexors and they're getting tight.
Yeah.
So yeah, it is. Yeah. Yes, it is kind of the same, which is another reason, hip flexor tendinopathy, I think, is even more common now because of the repetitive use of the hip flexors in running, but also because we're sitting so much. And so they're just in this short, tightened position all the time. They're not getting stretched out or the hip's not moving in other directions, because our hip is a ball and socket joint. It's able to move in all sorts of directions, but we're keeping it like locked in this position most of the time. Both when it's like this a lot when we run, and then it's like that all day if we're sitting or commuting. So doing that hip flexor stretch that I showed earlier is really important, especially after running and even after sitting all day. And then remember, you can add the arm up, hold 10 seconds minimum.
That's good. Yeah, that's really good.
There's one other toy that I want to show people. So we talked about the ball, the stick, the foam roller. Has anyone seen a Theracane? So it's basically like a self massager. They're not too expensive, and you can see the ball kind of on the end. So the idea is that you're able to put this on your upper trapezius or rotator cuff, shoulder muscles, neck muscles, and you kind of can pull it down, and it's like a self massage. So in our Zoom culture as well, I find this very helpful. Also, if you are running long distances, you may have already heard, or you might feel towards the end of your long run, like it's common for us as we get tired, for us to hike our shoulders up when and we should be keeping our shoulders relaxed when we run. So releasing your traps on your own with the Theracane can be really helpful. There's so many muscles that we can massage ourselves, but it's really hard to massage your trapezius muscles yourself, but this does the trick.
Would you find, like, would you say that using that one would be the same benefit as kind of using a ball if you're lying on your back?
No, this is better. Yeah. So I've tried, because like if I put a ball and I go on the floor or against the wall, like it doesn't get, I can't get it in the right position, and I'm pretty flexible and mobile, so like if I can't find it in the right position, then the average human body is not going to be able to find it. Whereas this, like, you know, you find that trigger point, that spot, and all you do is just put pressure down, and it releases it, and it feels great. And you can do some active release yourself. You know, you can pay a chiro for doing active release therapy, or you can do it yourself with the Theracane. The other thing I like about this too is if you are working and you're in meetings a lot of the time, turn your camera off and you can just work on this while you're sitting in on the meeting. And for me, I get a lot of stiffness in my neck muscles here, so I find this again great, because so now I'm just putting the pressure this way, so I find this great for releasing this. This also comes in a couple different, the plastics can be more stiff or less stiff. So this one is not the most stiff one, so I personally would recommend one with a little bit of give, but you can see what your local sports store has. I got this at Flamin Fitness in Richmond, so I'd imagine, oh yeah, and it's good for pecs too, pec release. So the foam roller, your ball, the stick, and the Theracane is everything that I would recommend a runner have in order to be able to do some self-recovery. If we could get massages every day, that would be the best, but that's not realistic for many reasons. So being able to have these tools and self-manage your pain and recovery and rehabilitation, and like always make sure your body's prepared for running as well as for life.
Absolutely.
Great. Thank you so much for that.
You're welcome.
Does anybody else have, you can hear me, right? Does anybody else have any last questions before I let you go off and enjoy the rest of the evening?
Just one more thing. You talked about fascia, and sometimes myself and a friend of mine actually get quite down one side after exercise. Is there anything you can do to sort of keep that fascia either flexible, or is foam rolling the best thing for fascia, or is there something, because foam rolling is very difficult on arthritis, on hands, on elbows.
Yes. I would recommend, so when you talk about the fascia down the side, are you talking about the IT band, like kind of from down the hip to the knee?
Yeah, probably. It goes all the way down, yeah.
So the stick is really good for that too. So if your hands are okay grabbing the rolling pin or rolling the stick, then this is really good for the IT band as well.
Okay.
And it is a lot easier to do this than to be on the floor moving your whole body weight up and down.
Yeah.
Yes. So
Okay, that's
try
good.
that out. And then there's also this stretch for the IT band is the leg you want to stretch, you put it behind, and then you lean over this way
Oh, okay.
and
Right.
hold 10 seconds. If you don't have good balance, make sure you're holding onto the back of the couch or counter in order to stretch that. 10-second hold minimum.
Great, thank you.
So thank you everyone for attending this evening. I hope you learned a few things to help keep your bodies in tip-top shape for running. And just as a little bit of inspiration, I want people to know that it's not aging that affects us from slowing down, it's inactivity. You know, if you stop playing, if you stop moving, then that's when the bodies become stiff and painful. And so I would encourage everyone to keep playing, whether it's through running or dance or gardening. Make sure that you keep moving.
Thank you. Thank you so
You're
much.
welcome.
That was great. And yeah, just if anybody has any questions to follow up, feel free to email me and I'll pass them on your way. And then your company also does home visits, right? For
Yes.
your
So I am owner founder of Physio2U, and we provide in-home physiotherapy services. We're also mobile. So I have been known to meet people at the track or on the water for paddling assessments and treatment. So sometimes it is nice to actually see people move in their natural environment rather than just watch you squat and balance on one leg in a cubicle. So please check us out, physio2u.ca, if you want to learn more about the in-home and mobile visits that myself and my team provide.
And I'll keep a link as well to the company and to yourself in the newsletter. And of course, we'll post this video next week.
Thank you.
Thank you so much, everyone. Have a good evening.
Thank you.
Thank you.
Thank you.
Bye.
Thank you very much.
You're welcome.